Adams. I am the regional for Conviva here in Palm Beach County, and we are so honored and very blessed to be here to see you all today and to let you know who we are and introduce our physicians and our team. Conviva Care Center is part of, can you hear me okay, everybody?
No.
Okay. We are a very large physicians group, not only in Florida, but also in Texas. We have over 90 locations in both states. In Palm Beach County, we have a numerous amount of locations that our marketing team is getting ready to do a nice map that we'll be able to get to Harbor's Edge, so you can show the many different, we can show you the many different locations that we do have. What we do at Conviva is our goal as primary care physicians is to give you that patient-centered experience from us, because as we all know, we're aging well. At least that's our goal. A lot happens at Conviva as a primary care doctor. They collaborate with our physicians that we are affiliated with at the hospital. We have a hospitalist group, Florida Hospital Specialists, that we use. So if they do see you in the hospital, they can collaborate that medical care with your primary care doctor. And if you choose to stay with Dr. Reyes and Dr. Diaz here at Harbor's Edge, they will collaborate with them as well. We have care coaches that at the end of your discharge, we make sure that everything is taken care of. If it's a home health need that you need, if it's durable medical equipment, we help to arrange that to make sure that transition is very smooth for you. Same way if you should happen to go into rehab, we will also coordinate that care. At Conviva, as I said, our goal is to be very patient-centered. We will also have the opportunity, we'll have in our office here in the clinic, the capability of doing your lab work. So if you should run into a situation that you see the physician and he wants to do lab work, we can do that right here on site for you. We can also do cardiograms if the doctor feels there's a need for a cardiogram that needs to be done. We have that. We have a team that's going to be joining us. We have a center administrator. Her name is Jessica Rivera, and she is out of our Conviva Del Rey Center at Central Del Rey. We have medical assistants that are certified, so they work to their highest expectation of their certification, which is very nice, and we appreciate that and the effort that they do. We have Brittany with us here today. Christina will be with us tomorrow. And we talked about the hospitalist and what those doctors do and how they collaborate the care with you. You might have seen out and about, if you're able to do that nowadays, that we are on billboards. You'll see the Conviva name on billboards. You'll see the Conviva name in TV ads. You'll hear it on the radio when you're listening to the radio. And it tells you a lot about what we do and how patient-centered we are. And with that, Dr. Joe came to our managing partner, Dr. William Russell, to talk about Conviva being the on-site provider here at Harbor Edge. And Dr. Joe brings many years of experience, as some of you might already know, that he's here, and he collaborated this venture with Dr. Russell. We are extremely pleased to be here, and we hope that the service that we provide for you is exactly what you're looking for. We take many different forms of insurance, just so you're aware. We take your traditional Medicare, we take Aetna, we take Care Plus, we take Humana, we take some PPO plans and some HMO plans. But as you all know, insurance is important for everybody. So if you have any questions for anything at the end of our talk, we'll be glad to answer them for you. And if we don't have the answer, we'll make sure to get that for you. Because sometimes we don't always have the answers, but we are so very pleased that you're here joining us today. And with that, I would like to introduce Dr. Joe Oslander, and he will tell you a little bit about what his plan is for here. Thank you, folks.
Thank you. Good morning, everybody.
Good morning.
I think many of you know me, Dr. Joe. I've been working with Harbor's Edge now for at least 3 years. And a lot of my effort has been focused on trying to meet the residents' needs for an on-site clinic. And as you know, many of you were at meetings in this room when we had another group start the clinic. The clinic's named in honor of the driving force behind starting the clinic here. And LifeSpace made a decision, I think in collaboration with the health committee, to make a change in the management of the clinic. And Dr. Ham asked me to look into other physician groups. So I have a very close colleague, and he's a close friend now, that Cindy mentioned, named Dr. Bill Russell. He is a geriatrician and also certified in palliative medicine, who trained at Johns Hopkins and has spent many years working in facilities like this. He is the physician managing partner for Conviva Care Centers, physician group for Palm Beach County. In Palm Beach County, Conviva has 17 offices and cares for close to 25,000 older people, just in Palm Beach County. In the rest of Florida, there are dozens of other Conviva offices in Broward, Miami-Dade, and there, as Cindy mentioned, there are several offices in Texas. So we were able to work out an arrangement with Conviva physicians, and we're very fortunate for that. The services that will be provided in the clinic here will be essentially identical to what we've had previously. But there are some differences. The first difference is that the people who will be working in the clinic have special training in geriatrics. Okay, and so we're going to hear from Dr. Rodolfo Reyes. Dr. Reyes was one of our internal medicine residents at FAU, and he went and did a special training geriatric fellowship at Massachusetts General Hospital at Harvard Medical School, and now is back working with Conviva physicians. And also Dr. Sandra Diaz. Dr. Diaz is a nurse practitioner who trained as a physician in Bolivia. And I met Dr. Diaz when I first came to FAU to help start the medical school about 13 years ago. And I've been working with her since. And so that's one, and Dr. Russell also, as a managing partner, is a trained geriatrician, and I will be working in the clinic as well. And I'm a trained geriatrician. The other, I think, advantage is continuity of care. So Cindy mentioned that if you need to go to the hospital, Conviva works with Florida Medical Specialists, which is a hospitalist group. But the other option for you is, for residents who need to go to the hospital, is that at Delray Medical Center, we have a geriatric service. And a geriatrician who's a professor at FAU named Dr. Bernardo Reyes, not Rodolfo Reyes, Bernardo Reyes, they're not related, runs the geriatric service there. And you can either be admitted to that service or be seen in consultation at that service. And Dr. Diaz, as a nurse practitioner, she works at Delray Medical Center and helps with the coordination. She'll be helping the care coaches with the coordination, so that if you go to the hospital, we'll know you're in the hospital. We can see you in the hospital, and if you need rehabilitation after you get out of the hospital, Dr. Diaz and I work in the health center here as well as Abbey South. If you go to Boca Hospital, again, Conviva has Florida medical specialists, at Boca Regional, we also have a FAU teaching service there that we work with, which is where Dr. Rodolfo Reyes trained. And similarly at Bethesda Hospital as well. Both are available at Bethesda. So we'll have the clinic available to start with 3 half days a week, and just as previously. And if you need to be seen in between, there are at least a couple options. One is now with the pandemic, we've been doing a lot more televisits. So we can arrange televisits. That's number one. We can arrange visits in your unit if that's necessary. And if it's necessary to be seen in person, sometimes you need to be seen in person when the clinic isn't open. The Conviva office that Dr. Reyes works at is literally about 3 miles away. It's 2 miles, I clocked it, it's 2 miles north of the intersection on Linton and Congress. So it's very close. As Cindy mentioned, we'll have lab services. Every time we're in clinic, there'll be a medical assistant here who is also trained to draw blood and take urine specimens, do EKGs, and help with that. So we will be able to provide with Conviva physicians, in collaboration with Conviva physicians, full spectrum of services from clinic, televisits, hospital care, and rehab care if you need it. The question always comes up is, what if you have your own primary care physician? And that's fine. We'll be happy to see anyone who needs to be seen. Unlike previous situation, the goal of this operation is not to make money. The goal of this operation is to provide good care for older residents of Harbor's Edge, and we're also having a clinic at Abbey South. That's our goal. And so we will we will accommodate anyone who needs to be seen, even if it's just for a lab test. But I want to add one other thought to that, just so you understand, that if you do have your own primary care physician or a specialist, and we see you, it may be necessary for us to communicate with that physician, depending on what the situation is, because it's very important that physicians communicate with each other to provide good care. If it's a simple problem that your physician doesn't know about and need to know about, or your specialist doesn't need to know about, that's one thing. But if it's something that we need to make a decision about, we may have to do that in collaboration with your primary care physician or a specialist that you already have. So it's fine if you have a primary care physician or a specialist, but we'd also welcome you to be have primary care done by Conviva. Okay? So with that, I'm going to let Drs. Reyes and Diaz briefly introduce themselves, and then you can ask questions. Yeah. So, Dr. Reyes.
Good morning. So like Dr. Joe already said, I'm originally from the Dominican Republic. I came here to FAU to do my internal medicine residency. At the beginning, I wanted to be a cardiologist, then an intensivist. But when I actually did my geriatric rotation, that's where I fell in love with geriatrics. And Dr. Joe was one of my attendees. I was actually a little bit, you can say, I was not liking the way medicine was being practiced once I was in residency. I thought medicine was beautiful until I went to the real life. And I noticed that the patient took another priority. That there was other priorities for the hospitals, other priorities for the doctors. And in geriatrics, that's where I learned about patient-centered medicine. And I was like, patient-centered medicine, that should be the only way that medicine should be practiced. So that's really took my attention, especially in the middle of my crisis. I'm like, well, what is this type of medicine? It's definitely not patient-centered. You go to a hospital and they tell you how many days you stay. They're worried about other numbers, but usually what the patient wants, or the priority of the patient, it takes like another dimension, pretty much. It's not the first thing that they take into account. I also noticed that a lot of the things that we do for the geriatric population, there's not a lot of evidence. And again, Dr. Joe, he's the editor of the Journal of Geriatrics. And I noticed a lot of the things that we do in the elderly, there's not much evidence. And then I thought, we don't give the same medication to children or the same dosage, and their function is different. Why are we doing the same thing for geriatrics? Why are we treating them like younger adults? Especially when we don't have evidence that this is the best practice. So that also caught my attention. So then I decided to do, instead of cardiology or intensivist, I decided to be a geriatrician. So I applied for my fellowship at Massachusetts General Hospital, which I met fantastic physicians, very good physicians. And I decided to come back here at the Ray, where I trained initially for internal medicine. I really liked it. I was living here in Congress with Lincoln, very close from here. So I decided to come here, and I really liked it. Again, I work in Conviva Central Delray. I love Conviva. The reason I like Conviva is because it gives me the tools to practice good medicine. In other practices, I would probably have to see 20 to 30 patients a day. Here, so far, I haven't seen more than 10. So it gives me good time to practice good medicine and to know the patient, not only their conditions or what medications they are, but what matters the most to you. What are your goals, and how we can achieve those goals or try to achieve those goals together. So I'm really happy with Conviva. There's very few practices that allows you that opportunity. Again, this we are doing just to help older adults. I don't know if you care, but I get paid the same. It's the same salary. So this is definitely something I'm doing extra, and I'm doing with a lot of passion, and I'm actually very excited of being one of the physicians here at Harvard-Sage. Actually, I came at Harvard-Sage when I was in training in internal medicine. And I really liked it, especially the pool, the A1A, beautiful. Yeah, I saw some of doing some exercises. I'm like, wow, I want to retire like that. No, definitely, better than my lifestyle. I'm like, wow. So this is definitely a good community, and we just want you to be as healthy as possible and enjoy, I don't know how many years, hopefully a lot of years, as happy as you can. Any questions? Or, yes, let's go with Sanya.
Good morning, everybody, and thank you for the opportunity to have me here. I'm very, very happy about this clinic starting. Dr. Arslander and myself have been at the health center for almost 2 years, and we've been able to provide care for the people who need to be at the health center. So I'm very familiar with the activities that they take care of it and there, and how they are really committed to provide good care for all of you and anybody who comes for rehabilitation there. So this opportunity to expand that and get to know you, and as Dr. Auslander said, it's so important, continuity of care. I feel like if we have the possibility to follow your cases from here to the hospital, to the health center and back here, while physicians and nurses communicate on what's best, brings the best outcomes for the patient. And most importantly, listening to what your goals are and having that as a priority as well. I'm a nurse practitioner, and I really like what I do. I've been trained by the FAU physicians, Dr. Auslander, Dr. Bernardo Reyes, in geriatrics, and I can tell you that older adults bring the best of me. So to me, it's an honor to be here today. Any questions?
Any questions at all?
Yes, ma'am.
We have a microphone that will
Let me get you a
give
microphone.
everybody to
I'll get you a
use.
microphone.
Let me just say for a second. Folks, just so you know, the gift that we have given you, let me back up a minute. I just want to thank Dr. Joe and Dr. Diaz and Dr. Reyes for their kind words. And what I hear, what they're saying is exactly what we want to offer you. It's that collaboration between you, each one of you, and the doctor, and how you want to be aging well. It's such a value, and it's like Dr. Reyes was saying. He decided to go to cardiology, and after being at FAU and finding the mentor of Dr. Joe, decided to go into geriatric, because there's a passion in our heart to take care of you, and that we want you to age well. And I thank you for your words. It was very, very nice today. In the gift bag that we've given you is our hours that we're going to be here. We'll also have it placed at the clinic, so you'll know. We have the bio of the doctors, so you know who they are and their background. We also put in there, for your convenience and the comfort of your own home, if you'd like, we have a medical records release and what they call a patient demographic form. So if you choose that you'd like to go ahead and pre-register with us and have that part done, you can. We have an envelope in there that you can put that information in and bring it to the clinic. And if we might not happen to be there, I'm sure James will let us have. I think we're going to get a mailbox, right?
I said you could
Yes,
put it
no
in.
slots. Okay, good. And that way you don't have to worry about doing that paperwork when you come in. And just wanted to touch base with that for you and let you know that there will be some more marketing material that we're bringing out. Like I mentioned, a map of all our different locations. So if you're out and about and you might not be feeling too well and you'd like to see a physician, we have those locations that are around Palm Beach County that you could be more than glad to go in, because we do have same-day service at our locations, just so you know. So with that, thank you. I'll give it back to Dr. Joe. Or no, you're good? Couple more words, and then we got some questions. And
We got questions.
yes, ma'am.
I just have a few short questions. Would we have the vaccine? Will you be administering the vaccine to all of us?
The answer is, I'm not sure we know the availability of the vaccine and when it'll be available. But what I will say is, this is on behalf of not just Conviva. I work with LifeSpace. I work with Dr. Ham directly on issues related to the pandemic. That if there's a vaccine that is adequately effective and safe for older people, we will do everything we can to get it to people. You have to understand, though, for nursing homes, there's an application process already in place now. I don't know if you know this, the federal government has contracted, at least initially, with CVS and with Walgreens to provide the virus to nursing homes. So LifeSpace has already applied for that. But I'm going to tell you that vaccines in general, and the vaccines that are coming out are not, they're not meant to necessarily prevent people from getting the virus. They're meant to, if you get the virus, to not have a severe illness. And they don't prevent people from spreading the virus. And older people don't have the same immune response to vaccines as younger people. So that's why we are heavily focused on, with the upcoming flu season, getting all the staff vaccinated and making sure that we don't have visitors come who are sick. Because that's just as important or more important than everyone getting vaccinated. But, as I said, if there's an effective, safe vaccination for older people, we'll do everything we can to get it.
Thank you. My other question is about Conviva. That to me is a new word in my vocabulary. Could you tell all of us where all your other offices, are they mostly dealing with retired places or retirement homes or senior citizen homes? What are all they located?
Well, as Cindy said, she's going to provide a map of all the offices. Conviva is a physician practice that is outpatient, and it's largely older adults.
Yes.
It's almost exclusively
In
older
resident
adults.
homes, in senior resident homes?
No. This is, I think this is, as I said, the managing partner, Dr. Russell, who's not here today, has a lot of experience in setting up programs like this in homes, in homes like this. But this is the first agreement with Conviva physicians and a place like this. But it's going to be, it's pretty seamless. You in your packet, you have one phone number to call, whether it's for scheduling, questions, off hours calls, one phone number.
Yes.
It's a full service practice.
So you're affiliated with hospitals?
Yes,
Mostly.
all the hospitals. And Conviva, there, as I said, at the hospitals, one option is to be cared for by the physicians that work with Conviva, the hospitalists, okay? But the second option is that at each hospital, there's a FAU teaching service, where we have FAU faculty as the attending physician. So there are options at all of the hospitals. And as we said, we work, Dr. Diaz and I work in the health centers right now at here and at Abbey South. And in collaboration with Conviva, Humana is looking at getting a contract to care for people in the Abbey South Health Center. So there'll even be a closer relationship. That doesn't have to do necessarily with any of you, but it does have to do with the fact that Dr. Diaz and I and Dr. Reyes will be involved in the care, whether it's outpatient, hospital care, or care and rehab center. One of the most important things is continuity of care and communication, and that's what we're going to have. Mr. Schwartz.
Mr. Schwartz.
I would first like to invite all of our residents here, whether or not you intend to immediately make use of the clinic, to please fill out the applications. We had a few emergencies last year, and it was a difficult situation where people had to be hassled by the fire department and the hospital for information that they were in no condition to want to provide. If you fill out the information here, it's provided to the fire department, and also it will make life very easy for the doctors. But I have a question. We had an incident last year with the previous group in which a very sick patient called late at night with a question, and she reached a doctor at that group who didn't know who she was, didn't have access to her records, and was unable to help. So the result was a visit to the emergency room. My question is, if one of our residents here has a question, a serious problem late at night, and they call the number that's here, what will the person at the other end have available to them? Will they know something about the patient? Will they have a medical record available? What will they do?
So, that's an excellent question. So, I work 1 day a week with Conviva, and my role is largely educational and very high risk, but I do know this is part of the role of Cindy and as well as Dr. Russell to educate all the people who take those calls about what we're doing. The other thing I'll say is all the physicians have access to, we use the same electronic health record, eClinical Works. It's the same one we use at FAU as well. So anyone who can get into eClinical Works can immediately pull up your record. And we'll be able to find out what diagnoses you have, what medications you have, look at the most recent notes. So I think it'll be a matter of educating, because it's not going to be Dr. Reyes and Dr. Diaz or myself on call all the time. That's true, we were just not. But they'll be made to understand that I meet with all the physicians in this area every week, once a week. We'll let them know that, but it's true you have access, correct?
Absolutely, yes.
To ECW as well.
Yeah,
we have an on-call system. Usually I'm every other week for 5 days. And we definitely take any urgent calls, and we have access to ECW at home. We don't have to be in the office, and anyone in Conviva has the same access. That's why it's very important for you to fill out the release of information, so we can have those information as soon as possible, because it's gonna take a while, to meet with each of you. But if we start with at least some of the history, that will help us significantly.
I think that's what Mr. Schwartz was saying. If you fill out the paperwork, it doesn't obligate you to anything, it doesn't cost you anything. But if you want to use the clinic and you get sick and you call, then you'll be in the system. That's I think what you're saying. Yes?
How do you coordinate your personal internist with you?
So, that's a good question. It always comes up. I tried to address it. So, I think we've talked about this before, you and I. So,
That's right, you have a good
so,
memory.
I don't know about that.
Address the question?
I'm sorry?
What was the question?
I'm sorry. The question is, how do we coordinate care with, if people have their own primary care physician? So I think that it depends. So it depends, number one, on the clinical situation. And number two, on what the person wants us to do. The patient wants us to do. So, as an example, if someone comes into the clinic and they have a little scrape or a bruise, Dr. Diaz is going to be wound care certified, so we'll be able to fix that. Your primary care physician may not need to know about that. You may want to tell them, we could tell them. But if you come into the clinic and you have some new symptoms, and we think you may need adjustment of your medication that your primary care physician put you on, then we're probably gonna have to talk to the primary care physician, because we can't make assumptions about why you're on a medication or not on a medication, whether you've had a test or not. Some people don't remember whether they've had a test or not. So we would have to contact the primary care physician for that kind of information to provide the best care we can. Does that answer your question?
Yeah, more or less.
I'm not sure what else to say about it, but.
Any other questions? Going once, going
Sure.
twice?
Dr. Joe, one comment?
Yeah, sure.
You know, something that we already do currently at our Conviva care centers is whether you're a new patient or an established patient, it's always good to bring your medications with you to your visit. So that way it gives, even if it's your vitamins, we ask, that way Dr. Reyes, Dr. Diaz, even if Dr. Joe happens to be seeing you that day, they can really go over your medications. Do you agree, Dr. Joe?
So,
Be a good thing to do?
Well, certainly if, the first times we see you, we want you to bring the medications if we make changes. But one of the things we do, at every visit is in the electronic health record, there's a list of your medications, and it says whether you're taking them or not taking them. And at every visit, we update that. And if we don't know, this has happened a lot when I was working in the clinic previously. If we don't know, we ask you to come back, go get your medicines and bring them, or bring them the next time. Because let me tell you, if there's one thing that we deal with all the time in taking care of older people is medications. People are on, in general, they're on too many medications. And that may have been prescribed for an appropriate reason at one point, but they don't need them anymore, or they need to have adjustments. So we absolutely need to know what medicines you're on, and if it's necessary for you to bring the medicines in, we'll want you to bring them in. And that includes everything you're taking. Yes?
We're going to take care of contacting Glades Medical if we sign up with you to have all of our records transferred to you. We won't have to take it.
You have to sign a release.
Okay.
That's just standard, just like you've done in the past. You have to sign a release so that we can get medical records.
It's in your package.
Yes.
Okay, I haven't seen the package.
Yes.
Yeah.
And just so you know, folks, Dr. Reyes had the privilege of, about a month ago, we had a patient that was from Harbor's Edge that wanted to be seen, and maybe Dr. Reyes can talk about that, not what happened, but that we were able to see that patient at where Dr. Reyes is based, out of our Central Delray office, and how smooth that went.
Correct. Due to HIPAA, I cannot give a lot of details. But yes, he or she wanted to be seen earlier, so we make that happen. Actually, probably the next day. It's very fast. And here in Harbor's Edge, they actually arrange transportation. Overall, he or she, or it, has been very happy.
So just to let you know, we're available for you, whether it could be here on site or at the office. Yes, ma'am?
Mr. Schwartz mentioned a package.
Wait.
What is the package?
The
What
package,
we gave you.
what we've given you in the Conviva bag
Oh, there's
Yes,
things in
yes,
here?
ma'am, yeah.
Okay.
is a sanitizer, because you know, we're all in this together, and a mask, a Conviva mask, so you have another mask if you'd like to have. You know, now we all should be in the business for masks, right? Mask and the barriers. Conviva mask, we also have our hours of operation here on site. We have the phone number, which will be the phone number that you will always call, because you'll be reaching out to the Central Delray office, and they will make sure sure that Dr. Reyes sees you that day there, or we arrange for you to be seen here by an appointment. We also have in there the biographies of the physicians and their backgrounds, which I think is very important because people like to know who those physicians are that they're seeing and what brought them here. So we have that as well. And yes, ma'am.
I just would like to confirm, are you telling us that if we have a concierge doctor, which many of us do have, you will work with them?
Yes, doesn't matter whether they're concierge or
So
not.
if we sign your contract, it doesn't mean that we're giving up our concierge.
I tried to say before, that isn't a contract. It doesn't obligate you to anything, it doesn't cost anything. It's information so that if you need to come to the clinic, information is already in the system.
Okay.
It doesn't matter whether your physician's concierge, non-concierge. If you need care in the clinic, we'll see you. And as I said before, if it's something that we need to communicate with your physician, we will.
Okay, thank
The
you,
answer is yes.
thank you.
But I just wanted to, there was a question about vaccines before that someone asked. And just to highlight what Zuni was saying, I heard a physician on the way here talking on the radio, who I agree with. And he said that if I had a choice between social distancing, meaning not going into crowded areas where people are too close together, wearing a mask, or getting a vaccine, the vaccine would be third. And I agree with that. Despite what you may hear from some officials in this country, probably 80 to 90% of this pandemic would go away if the American public would cooperate with basic infection control procedures that everybody can hear.
Vote blue.
So true.
I'm trying not to make a political statement, but I won't say anything more.
I have a question.
Yes,
If somebody gets sick in the middle of the night, is there anyone to call? I know they can't see us in the middle of the night, but make an appointment for the next day with someone.
yeah, so we said that before, you may have been out. You may have been out, yes, there's one phone number, there's physicians on call. If you're signed up, you sign the paper, we'll have access to records, your records.
I mean, let's say you think you're having a heart attack in the middle of the night.
Well, depends on the situation. So the physicians are all skilled in determining whether you need to go to the hospital or not. Our preference is that you not go to the emergency department or the hospital. That's even apart from the pandemic. The pandemic makes it worse.
Yeah.
So we really try not to send people to the emergency department or the hospital because you know there are risks associated with going to the emergency department and the
Just
hospital.
curious, is there anyone in the health center, if somebody has this problem in the middle of the night, for them to go over there? Is there anyone trained over there to help?
There is no physician or nurse practitioner. I don't know if nurses from the health center ever do that. No.
They used to come here when somebody fell down, but
Yeah.
I don't believe they do.
Yeah, so actually Dr. Russell and I are actually discussing a program where one of the most common things we deal with is falls. We're discussing a program where if somebody falls down and they're not obviously acutely ill, we're discussing a program where we might have somebody available to come, not a physician, somebody trained, and they to come, but also we would do a televisit. So that meaning if somebody falls down, we would send someone to someone's unit. They would show that we would examine them over like a iPad or a computer and determine whether you need to go to the hospital. That actually reduces the need for people to go to the hospital. And Conviva has that capability, is going to have that capability. So Dr. Russell and I are talking about that now. Could save a lot of misery. Because, to be honest, a lot of people who fall down don't need to go to the hospital. But if they do go, they get tests and then they get admitted to the hospital. And we don't want that to happen unless it's in your best interest.
I have a question.
Yes?
First of all, thanks a lot for all the information about Conviva. However, what would the exact translation of Conviva mean? What is the?
I don't know, I've asked people that.
The name, it means living well.
Living well.
Living well. Well, thank you very much.
It fits with our clinic.
And that's our goal for you, to age well and live well.
How are you going to coordinate this with our concierges? I wasn't well for a few days, busy spells, so of course I called the concierge. Before I turned around, an ambulance was here, and they took me to the hospital. Now previously, when I first moved in, a nurse came up to evaluate. This is not happening now, in my experience. So, you're laying on the floor, you press the button, you can't call or make a phone call.
I understand. What I was talking about was a program that we're thinking about implementing. In terms of when you call your concierge physician, if that concierge physician orders you to go.
Not concierge, the concierge is in Harbor's Edge. The people that you call downstairs if you want to go shopping.
I'm sorry, I misinterpreted you.
That is the.
Yeah, I guess we can educate them about the availability.
Very, very important.
Yeah, I don't know, maybe we can talk with Mr. Horstman about what we should do with
You
that.
have to educate them.
Yeah.
If somebody calls down.
That's a good point.
Before they call 911.
Well, that's exactly what I was trying to say, and we're gonna try and, we can do that.
Good.
And, we don't automatically have to call 911, but the safest thing to do is to do a visit, either just a telephone visit, or have somebody come out here and come to the unit and help, if possible, appropriate, get you off the floor, and also, and see about the need to go to the hospital. And that can be done, on a computer. That person.
If you're lying on the floor, you're not near your computer, you're not near your telephone, you're there, this thing you have on
I
your
get
wrist.
it, I get it. So what we want to do is try to implement a program, if we can get the program together, is when that happens, whatever, we'll work with Harbor's Edge in collaboration with Harbor's Edge, but from Conviva's standpoint, we want to send a trained person to the unit who will bring a computer or a iPad.
However you do it, but.
I'm just saying that way I can examine you and determine whether you need to go to the hospital or not via the computer with someone there.
Well, the computer can't get you up off the floor.
I understand. We'll get you up off the floor for sure.
Work on it.
Yeah, we're gonna work on it.
Work on it.
It's a huge problem.
Right.
Good questions, my dear,
Yeah.
good questions. Points to take back, for sure.
Me too. Anybody have any other questions?
Good?
All right.
Thank you all.
Thank you all
Thank you,
for coming.
you guys, very much.
Thank you all.
Dr. Joe,